Veneer techs.
There's no such thing as a veneer tech.
Veneer technicians have been popping up over America, and honestly, if something isn't done, someone could die. So if you have not been paying attention, people with no dental background are actually going to these workshops where they learn to place composite veneers. So in this video, we're going to be having an objective analysis on the risks and benefits of seeing a veneer tech versus your dentist. Make sure you stick around because a lot of these benefits are actually double-edged swords. So if you don't know, composite is a material that we use to repair dental cavities. So in this case, with composite veneers, we're actually using the composite on the front of the teeth to change the shape of the teeth or color of the teeth. One of the main benefits of composite veneers is that you're sticking the composite material directly onto the tooth and you're not having to cut away any of your tooth to do that. Now the second benefit is that they can be seen to be easy to do, especially if you've had some training in doing nails. Placing the shellac or the acrylic onto the nails is actually quite similar to how people place composite veneers. And the third benefit, the cost of doing composite veneers is way cheaper than if you did porcelain veneers. And the last benefit is the convenience. A lot of these veneer techs are just setting up in their own homes. They might even be able to visit your house and do it at your home. Alright, so now you've heard the benefits. Now here are my concerns. When a dentist looks at your mouth, we look at the whole mouth and we have a comprehensive approach. We want to work on your oral hygiene and try lower your risk of cavities so that we can make sure that those complicated and larger treatments are going to last you. Veneer techs are only trained to do composite veneers, and that can cause a lot of issues because what they don't know can hurt you. And we're already starting to see these kind of issues popping up. There are examples of composite veneers being done over large cavities and what appears to be infected teeth. That can cause a lot of problems, such as cavities getting worse under the veneers to the point where the teeth are no longer able to be saved. And if there's infection building up, that infection can get into your blood system, and that's where there is actually a risk to your life. So now let's look back at the benefits and figure out if they're really benefits. Now the first point was that the composite veneers are reversible. Just say one of your composite veneers chips away. Can you just repair one of those little corners? Well, no you can't. And that's because composite does not bond very well to your existing composite. What you actually have to do is shave away the entire composite veneer off of the tooth. And if you do that multiple times, you will end up losing a lot of your enamel. Now the second point is that composite veneers are easy to do. Well, the reality is that composite veneers may be easy to do, but they're hard to do right because there is something called gingival crevicular fluid, which is coming out of the gums. And that liquid is going to contaminate the surface of the tooth at the same time that we're trying to bond onto the tooth. Doing these veneers right also means that you have to bond the composite onto healthy tooth structure. So we can see that this person has had composite veneers done, and one of her teeth is still looking a bit grey through the composite veneer. So that's a sign that the cavity underneath there might not have been cleaned up properly and has just been covered up. Now the third benefit is that they're cheap. But if they're only going to last you a year and you have to redo it again, versus if you had it done at the dentist and it lasting 3-4 times as long, in the long run, it's actually not that cheap. The final point is convenience, because these people don't have to abide by a lot of regulation. But this does mean that they also aren't probably trained very well in infection control. And are they reusing tools for different patients, and are they cleaning the instruments properly? So there you have it. Personally, I'm very against these veneer technicians. I encourage you to talk to your dentist and discuss options and figure out what's right for you. After seeing a veneer technician, there's not much you can do because they're not regulated health professionals. They don't really have much liability.